Basically, an eyelid twitch is a repetitive, involuntary spasm of the eyelid muscle. The medical term for an eyelid twitch is myokymia, and these muscle contractions usually involve only the lower eyelid, although the upper eyelid may have these spasms too. It usually happens in one eye at a time. So, what exactly makes your eye twitch? According to Medical News Today, a one-time eyelid twitch may be due to electrical brain activity that prompts the nerve cells to flash signals to the muscles, which then leads to spasms. However, if the twitch lasts for several minutes to a few days, muscle fatigue or overstimulation may be the culprit, and may be commonly triggered by stress, excessive caffeine intake, having disrupted or getting insufficient sleep, dry eyes. Other possible causes of eyelid twitching, or factors that may worsen it, include alcohol intake, exposure to bright lights, irritation of the eye surface or inner eyelids, physical exertion, smoking, wind, dizziness, medications. Eye twitching can be bothersome, but they are oftentimes painless and harmless. Most of the time, they resolve on their own without requiring any medical attention. However, there are instances when eye twitching, especially persistent and chronic spasms, can be a sign of a more severe condition. One example is benign essential blepharospasm. This typically starts out as increased blinking of both eyes. However, it may lead to the eyelids being squeezed shut. While relatively uncommon, this type of eye twitching can severely affect your daily activities. The triggers and risk factors of this condition are similar to those of myokymia, although other potential causes include conjunctivitis and blepharitis. Benign essential blepharospasm is more prevalent in females than males, and affects at least 50,000 Americans in their mid or late adulthood. It can worsen over time, causing blurry vision, facial spasms and increased sensitivity to light. Hence, if you're experiencing chronic myokymia, it's best to have an ophthalmologist check your eyes to determine if you have this more severe condition. How to stop your eye from twitching? The most effective way to stop eye twitching from occurring is by identifying its causes and triggers. These basic lifestyle strategies may help resolve this issue. Reduce your caffeine intake. Try cutting back or eliminating caffeinated beverages like tea and coffee, as well as chocolate, from your diet for a week or two, and see if the twitching continues. Stop alcohol intake. Alcohol causes your eyelids to twitch, so it's best to abstain from it. Get enough sleep. Aim for 7 to 8 hours of high-quality sleep each night, and limit your use of electronics like TV and mobile devices before bedtime. Moisturize your dry eyes. Adults are prone to getting dry eyes, especially when they reach age 50. Taking certain medications, using a computer for long periods of time and wearing contact lenses may lead to dry eyes, so try avoiding these to see if your eye twitching will stop. Stay hydrated. Dehydration may lead to eye twitching, so try increasing your water intake. Address nutritional imbalances. While still inconclusive, there are reports suggesting that lacking nutrients like magnesium may trigger eye twitching. Get these nutrients from a wholesome, nutritionally balanced diet. Eye hydrotherapy may help ease this issue as well. Simply splash cold and warm water alternately over your closed eyes. The cold water helps constrict blood vessels while warm water dilates them. Eventually, this will increase circulation and blood flow to the eye. Most cases of eyelid twitching are mild and do not need any medical treatment. However, if you've been experiencing these spasms for a long period of time, it might be pointing to a nervous system or brain disorder, and may require prompt evaluation by a physician. Be on the lookout for these symptoms as well. Your upper eyelid is drooping. An unusual discharge comes from your eye. Your eye is red and swollen. When your eyelid twitches, they close completely. The twitching continues for several weeks. Other parts of your face are being affected. Oftentimes, eyelid twitching is nothing to worry about, and is just a sign that you need to make certain lifestyle changes. However, if the condition is chronic or you experience any of the worrisome symptoms, consult a doctor to get a proper diagnosis. It can indicate a serious illness.